Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Gambling disorder. So we are looking at the diagnostic criteria. So this diagnostic criteria is as per the DSM-5 diagnostic criteria. So there is a persistent and recurrent problematic gambling behavior. So it's persistent and also the recurrent problematic gambling behavior. And this leads to the clinically significant impairment, or it can lead to the distress as indicated by the individual exhibiting 4 or more or the following in a 12-month period. That is, within a 1 year span, you develop these points. That is, the gambling, it is otherwise defined as a placing something of value at risk. So value at risk. So something which is of value, putting it at risk with the hope of gaining something of a greater value. So gaining a greater value. So the criterion, the first one being the preoccupation. So preoccupation is where there is a persistent thoughts about the gambling and there is a frequent planning for the future gambling activities. So you have a frequent planning thoughts about the future gambling activities and reliving the past gambling experience. Then need to gamble with increased amounts of money. So there is need to wager large amounts of money to achieve the desired level of excitement as well as the satisfaction. Next is the restlessness of or the irritated when attempting to cut down or stop gambling. So here there is feeling of restless. So the individual may be restless, there is irritable. So restless, there is irritable while attempting to cut down or stop gambling. Next is the repeated unsuccessful efforts. This is to control or stop gambling. So you have a repeated unsuccessful. So repeated unsuccessful efforts, and this is nothing but to control or stop gambling. So there is unsuccessful attempts to control, stop gambling despite the desire to do so. Next, the gambling as a way to escape the problems or relive the negative emotions. So relive negative emotions. Using gambling as a way to escape from the problems or to relieve the feeling of the guilt, the anxiety, as well as the depression and helplessness. Next is the chasing losses. So what is chasing losses? Is trying to win back the previous gambling losses by continuing to gamble. Then lying about the extent of gambling, concealing the extent of gambling and activities from the family, friends as well as the therapist. Then jeopardizing. So jeopardizing significant relationships, jobs or educational opportunities due to gambling. So gambling related problems, they lead to a significant interpersonal conflicts or impairment in work or academic settings. Then comes the relying on others for the financial bailout. Then repeatedly relying on others to provide the financial. So relying on others to provide the financial assistance as a result of the gambling related financial problems. To learn and grow daily like this, please do subscribe.